Here I will try to concentrate on the optical part of the computer vision syndrome. I don't have any financial interest, even though I showing some of the computer vision syndrome. It is defined as a complex of eye and vision problems that are experienced during and related to the computer use. You know that it says repetitive time. This first question rises is, and most of the patients ask, sorry for that, whether there is radiation from the computer, and most of the patients attribute everything to the radiation. But to our knowledge, with the scientific evidence, there is not much of radiation coming out of the computer. With the light amplitude being charted against the horizontal location, the picture shows a bell-shaped curve. While the same light amplitude graph is on a printed matter, it shows in a perfect square. So that's the difference. So everywhere the brightness is not the same. In a pixel-based image, the eyes cannot focus and remain in that plane. So instead of that, it goes into a point called resting point of accommodation. So this resting point of accommodation is beyond the screen level. So that it is going to that point, then again coming and focusing on the screen level. So it is a repetitive thing. It goes on changing and it produces fatigue. So this is the one which is straining the eye muscles. So you will have the feeling of tired eye. So what are the patient's complaints? They will have multiple complaints. Some of them will have a double vision. Some of them will tell you that there is a temporary nearsightedness. After working in a computer for a long time, if they look through the window, they will tell that its images are blurred. Then they definitely will have dry eye, photophobia, then definitely the common symptom of headache, redness, watering. Then associated with that, they will have neck pain, backache, all sorts of things. How will you approach this thing? There is a 3B approach, that is to blink, breathe and break. So what about the blinking? Usual blinking, you are aware, it is told to 15 times per minute. When you are excited, your blinking rate will go up. When you are talking, sometimes your blinking rate will go up. The children comes with a frequent blinking with some of the psychological tension. And the blinking rate comes down when you are reading, thinking, especially when you are using computers. So if you rest it for some time, actually it reverts. And if you are blinking more frequently, it again helps. The breathing exercises are there to relieve so many strains, and that is applicable for the computer use also. There are yoga, other exercises and everything. Actually, if you knowingly breathe even and steady way, then that will relax your eye muscles also. Breaks, you can call it is different with the different terms, micro breaks, mini breaks and maxi breaks. These are all just a basic classification. Micro breaks, we call it as 10 seconds in every 10 minutes. Mini breaks around 5 minutes per 1 hour. So we have to discuss this thing with the patient. So what is possible in your working pattern. So the main aspect of this presentation is about computer glasses. What type of glasses we have to give to a person, and the person usually expects a glass from you. So when the patient comes and asking about a computer glass, or they have strain whether you want to prescribe a computer glass, and they will tell you that I am having headache after using computer, and that is actually your headache also, because it's very difficult problem to solve. Many of these patients will be above the age of 40 years, and monitor falls in the intermediate zone, or this testing point is another problem. So we can use glasses to reduce the glare, as already Dr. Andrews and all is mentioned. There are many branded glasses to reduce the glare. This Dr. Andrews also showed. This is for the single users. single power and for the progressive lenses. But a regular progressive is not that suitable. You have to select the proper progressive glasses for that thing. This is again the same slide of Andrews has shown. It actually improves your anti-reflective coatings will improve that person's look also, and person can have a glare-free vision also. How we can manage the computer glasses? For a presbyopic, you can add clip-on glasses and other types of glasses. The main question most of the time we discuss actually is whether a person below the age of 40 years is coming with a lot of problems, whether we have to prescribe any glasses for that person. Of course, anti-glare glasses are one choice, but this type of glasses, what is shown here is a rimless plus 0.25 diopter power glass. If you prescribe that type of glass, plus 0.25 glass, the idea is not to add any magnification. He can read, there is no problem. But definitely he will have a little large image, but the idea is to reduce his resting point of accommodation, so that his muscle need not to strain that much if he is using for a long period. Right? As I described earlier, the eye focuses on the resting point of accommodation, then comes back to the screen. So that distance will be reduced. So to some extent his strain will be reduced. Then we can use the flip focals that we can add according to the distance of the computer screen as well as according to the age of the patients. You can select it. Then you can, instead of flip-ons, you can use the clip-ons. There are many clip-ons available. You can have anti-reflective coatings on that thing. Again, this is positive powers, depends upon the computer screen distance as well as the patient age you have to select. As we have already mentioned, regular progressives with a very narrow intermediate zones, if you prescribe it, definitely the patient is going to come back because they will have a lot of problems. This is only a small area in the central, and he will have a neck problem, he will have head problem, many problems. So if you are selecting a progressive, you should be having a wider zone. So the problem with the wider zone is most of them are expensive, or you have to go to a specific occupational progressive lenses with a very wide central zone. So our present difficulties are, there are not proper, very suitable glasses, and which are available are really costly also. So we can try some alternative methods like clip-ons. We can, the regular bifocals, instead of that thing, you can have a clip-on or on the top part, so that patient will be comfortable. This you have to decide if the person is using computer for a very long period. Some bank employees and all we can try. Then alternative to glasses, suppose you fail in all these glasses, then you have to think about, or the patient refuses this type of glasses, he says it looks little awkward. Then you have to increase the monitor sizes, you can increase the letter size, you can increase the distance of the computer. So keep these monitors little below so that the dryness will be less. Suppose you keep the monitor on the higher on the table, then patient has to open the eye widely so that the dryness will increase, his problem will increase. And you can use the screen magnifiers like a Boschenloff PC magnifier. Again, there are glasses also for that thing. There are different methods to solve computer vision syndrome. The basic thing of solving the computer vision syndrome is to discuss with the patient. Tell, these are all the options we have. We can use glasses, we can use the adjustment in the workstations. And the selection should be after discussing with the patient, because what you select, sometimes the patient don't like it. So definitely the better way is to visit their workstation. Suppose one or two visits you are not able to manage it, then you have to tell, okay, you yourself or your optometrist can visit the site, or you can have a computer vision team. They can visit that place and can have the adjustment. And you have to again remember that sometimes the patient will be telling about so many eye problems, but basic problem will be with the ergonomics. So we have to access the workstation properly. Common complaints will be back and naked due to incorrect workstation design, chair position, angle of the monitor. This can also lead to SNOP, as I mentioned. So workstation, these are the points you have to concentrate about: the lighting, the glare coming to that screen, the flickers, color contrast, ergonomics, posture, work tables and desk, environmental conditions, etc. The screen brightness and contrast should be adjusted by the operator for the maximum view. You can ask the patient, say, you adjust your screen, you reduce or increase the power and see which light you are more comfortable. And there is a rule that the workstation lighting should be 10:3. So that the screen characters are 10 times brighter than the screen background. You can see that the background I have selected here is a blue background, so that the background is not that brighter. Instead of that, if I select a complete white background, if you are working on a software which is giving you a total white background, he is working from morning to evening, he will have more strain. So we have to try to adjust that type of things. And room illumination should be 3 times. Then these are all the common things. Locate the keyboard such a way that your wrist and overarms are parallel to the floor. Chair should provide proper back support and be adjustable, because sometimes many people will be using the same chair. Adjust the height of your chair so that the feet rest comfortably on the floor. Knees are about the level with the hips. So this will be an ideal posture, so that patient person will be very much relaxed and he can work for a longer period. And you have to remember, all these things add to his eye problems. So lighting, as I mentioned about the glare, you have to see that the top light, if it comes on, hit on the computer screen and reflects from that thing, or it hit on the patient specs, glasses, then again he will have problem. You will be changing the glasses from every month, but you won't have any comfort on. Clean the computer screen regularly. Ask to have short breaks. Suppose there is a window on the side and the light is coming directly reflecting to the computer screen, then you will have all sorts of problems. Then you have to put any curtains or drapes, whatever is possible in that situation, and reorient the workstation if necessary. Most offices have too much of light sometimes, and again that is going to produce problems. Then you imagine a situation like this: patient is near the window and his computer screen is on the window area, then he will have all sorts of problems, even if you are changing the glasses. So he has to change from that position. So you have to see, that's a very important thing. You have to visit the work site. Your optometrist or someone, you should train them and you should visit the work site. And we have to eliminate all screen reflections. We have different methods to eliminate all these screen reflections. And you have to remember that laptop computers are not for regular use. If you are using it regularly, you will have some time problems. So it's only for the mobile when you are moving. So you can adjust the computer screen, you can make the computer screen a little more heavy, so that again reduces. As I mentioned, if you use a plus 0.25 glasses, it reduces the strain. Similar way, instead of that thing, you can put the computer screen also a little heavy, so that reduces the weight. So you have to be comfortable in the PC, and thank you very much for it.